Hello and welcome to MedQuest. I'm Dr. Gracie Christie and I want to talk to you today about spider veins. You know what I'm talking about. They're those ugly, purpley, dark reddish, spidery looking things on the outsides of your thighs, maybe on the outsides of your ankle. Wherever they are, they bother us. We don't want to wear shorts, we don't want to wear capris when the summer comes. We really don't want to have them. So, spider veins. What are they and what can we do about them? A spider vein is a small little tiny vein in the dermis of the skin that has become distended with blood. It's no longer functioning properly, and unfortunately we can see it through the skin. I went online and I checked around a little bit to see what people are looking at when they think about how can I treat my spider veins. So I saw some things online and some of them make sense. Exercise, which is really good for overall venous health. It gets your blood pumping and it gets your veins working well. Compression stockings, which are a wonderful thing. If you have a lot of these little spider veins, you might want to use stockings that you can buy at the drugstore. Especially if you work on your feet a lot, it might be useful to wear these stockings that keep your blood flowing towards your heart and not pooling in these tiny veins in your legs. I did look on the internet and I saw that some people recommend home remedies for these veins. For instance, I saw, if you can believe it, cutting up sliced tomatoes and applying them to the vein. I can assure you this is not going to help you. Keep your tomatoes for your salad. The only thing that can work for these spider veins is to get in there and destroy the vein itself, collapse the walls, and then allow the body to go through its normal processes of getting rid of these cells that make up the vein. What can you do for your spider veins? You can go to a board-certified specialist who can treat them. The best treatment right now is called sclerotherapy. Sclerotherapy is when the doctor takes a little tiny needle, very small, and he actually goes to the vein itself and injects a special material into the vein, which causes the vein to collapse in on itself and sort of to be destroyed. The body then, over the next few weeks, will take care of removing all those cells and you will get significant improvement in your spider veins. The way it usually works is, depending on how many you have and how many you want to treat, you'll go to the doctor and they'll say, well, we can charge you X amount and we will work on your veins and inject your veins for a certain amount of time. Because let's face it, sometimes we have lots of little spider veins and it's a question of how much material is going to be used and how much time that the doctor is going to employ treating your veins. Another thing you need to know about spider veins is that they are not a medical problem. In other words, just because you have these little veins right underneath your skin that bother you, there's nothing necessarily going on deeper inside in your big veins, you know, the actual large veins that are really carrying a lot of blood from your legs and back to your heart where it belongs. These little veins, when you treat them, that's really a cosmetic procedure. So you can't expect, and we don't expect insurance companies to cover that as a medical necessity because it's most significantly not a medical necessity. That's the lowdown on spider veins, and I hope that all of you who are listening and are worried, watching, and are worried about your spider veins get a chance to treat them. Thank you.